Many people believe that weak bones are simply a natural part of getting older. They assume that once you pass 60, the body begins to slow down, strength fades, and bones gradually become fragile. In other words, it is just aging. But what if that assumption is not entirely true? In many cases, the real cause of bone loss is not age at all. The surprising truth is that the trigger may be sitting quietly in the medicine cabinet. Some of the most commonly used medications today are taken every single day by millions of people who believe they are protecting their health. Yet over time, these same medications may slowly weaken the skeleton without producing any obvious warning signs. There is no sudden pain, no dramatic symptom, nothing that immediately alerts a person that something is wrong. Until one day, a small fall happens. Something that once would have been harmless suddenly leads to a fracture. For many older adults, a fracture is not just an injury. It can become a turning point that changes daily life completely. Mobility becomes limited, independence begins to fade, and recovery is often far more difficult than people expect. My name is Dr. Javier Morales. For many years, I have worked closely with patients over the age of 60, helping them understand how different factors influence long-term health and mobility. Over time, I began to notice a pattern that appeared again and again. Many patients experiencing bone loss were not losing bone simply because of aging. Instead, the problem was often connected to the long-term use of certain medications. These medications are not rare. In fact, they are very common. Some are used for stomach problems, others are prescribed for thyroid conditions, inflammation, or neurological disorders. And in some situations, people take them for years without realizing how they may affect the body beyond the condition they were prescribed to treat. In this video, we are going to look at 5 medications that can quietly influence bone strength over time. More importantly, we will also talk about what you can do to protect your bones while still managing the health conditions that require these treatments. And the 5th medication on this list often surprises people the most. Before we talk about the medications themselves, it is important to understand how bone actually works, because many people imagine bones as solid structures that simply exist in the body like pieces of stone. Once they are formed, they believe bones remain the same throughout life. In reality, bones are far more dynamic than that. Bone is living tissue. It is constantly renewing itself through a process known as bone remodeling. Inside every bone, millions of tiny cells are continuously working to maintain strength and structure. 2 main types of cells are responsible for this process. The first group is called osteoblasts. These cells are responsible for building new bone. They create the matrix that forms the structure of healthy bone tissue and help maintain its density and strength. The second group is called osteoclasts. Their job is almost the opposite. They break down old or damaged bone so that new bone can be formed in its place. At first, this may sound destructive, but it is actually essential. Without osteoclasts removing old bone tissue, the skeleton would not be able to repair itself or adapt to physical stress. The key to strong bones is balance. When osteoblasts and osteoclasts work in harmony, bone remains dense and resilient. Old bone is replaced by new bone at a steady pace, maintaining the structure that allows the body to move, stand, and remain active. The problem begins when something disrupts this balance. If the cells that break down bone become more active than the cells that build bone, the body begins losing bone density over time. The skeleton slowly becomes thinner, more fragile, and more vulnerable to fractures. This process often happens silently. People usually do not feel it happening, and there may be no warning signs for years. Certain medications can interfere with this delicate balance in different ways. Some slow down the formation of new bone, others accelerate the breakdown of bone tissue, and some interfere with the body's ability to absorb the minerals that bones need to remain strong. Understanding this balance is essential because the medications we are about to discuss can quietly shift it in the wrong direction. The first medication we need to talk about is one that many people already know. It is commonly prescribed for inflammation, autoimmune conditions, severe allergies, and respiratory problems. These medications are called corticosteroids. Some of the most well-known examples include prednisone and dexamethasone. For many patients, these drugs are extremely important because they reduce inflammation and help control serious medical conditions. However, corticosteroids can also have a powerful effect on bone structure when they are used for extended periods of time. These medications affect bones through several mechanisms at once. First, they slow down the activity of osteoblasts, the cells responsible for building new bone. When these cells become less active, the body produces less new bone tissue. Second, corticosteroids reduce the body's ability to absorb calcium from the intestine. Calcium is one of the primary minerals required to maintain bone strength, and without sufficient absorption, bones gradually lose their density. Third, these medications increase the amount of calcium that is eliminated through urine. In other words, even the calcium that enters the body may not remain available long enough to support bone health. When these three effects occur together, the skeleton can begin losing density faster than many people realize. In some individuals, noticeable changes in bone density may begin within only a few months of continuous use. This does not mean corticosteroids should be avoided entirely. For many conditions, they are essential treatments. The key point is that they should always be used under medical supervision with the lowest effective dose and for the shortest necessary period. Another important rule is never to stop these medications abruptly. Corticosteroids affect hormone balance in the body, and stopping them suddenly can lead to serious complications. The second medication on our list works in a completely different way, but can create a similar long-term effect on bones. This medication is levothyroxine. Levothyroxine is a synthetic thyroid hormone prescribed to treat hyperthyroidism, a condition in which the thyroid gland does not produce enough hormone to regulate metabolism properly. It is one of the most commonly prescribed medications, especially among women over the age of 50. When the dosage is carefully adjusted, levothyroxine helps restore normal metabolic function and improves overall health. The issue arises when the dose becomes higher than what the body actually needs. Excess thyroid hormone accelerates many processes in the body, including bone turnover. In this situation, osteoclasts begin breaking down bone tissue faster than osteoblasts can replace it. Over time, this imbalance can lead to gradual loss of bone density and increased fracture risk. Because thyroid hormone needs can change, over the years, regular blood tests are essential to ensure that the dosage remains appropriate. The third medication on this list is one that many people keep in their homes and use regularly to manage stomach discomfort. These medications belong to a group known as proton pump inhibitors. Some of the most commonly used examples include omeprazole and pantoprazole. They are widely prescribed to treat acid reflux gastritis and stomach ulcers. For people who suffer from chronic heartburn, these medications can bring significant relief and greatly improve quality of life. But the stomach does more than simply digest food. It also plays an important role in helping the body absorb essential minerals. Stomach acid is necessary to properly break down and release minerals from food so that they can be absorbed in the intestine. When acid levels are significantly reduced for long periods of time, this process becomes less efficient. As a result, important minerals such as calcium and magnesium may not be absorbed in the quantities the body needs. Calcium is one of the main building blocks of bone tissue. Magnesium also plays an important role in bone metabolism and muscle function. When the absorption of these minerals is reduced over time, bones gradually lose some of the resources they need to remain strong. The challenge with proton pump inhibitors is that many people use them for months or even years without regular medical follow-up. Some individuals even purchase them over the counter and take them daily without realizing that long-term use should be monitored. The fourth medication on our list affects a different group of patients, but its impact on bone health is equally important to understand. These medications are anticonvulsants, which are used to control seizures and certain neurological conditions. Two common examples are phenytoin and carbamazepine. For people living with epilepsy or other neurological disorders, these medications can be life-changing. They help stabilize electrical activity in the brain and reduce the risk of seizures. However, long-term use of certain anticonvulsants can interfere with the metabolism of vitamin D in the body. Vitamin D is essential for bone health because it allows the body to absorb calcium from the digestive system. Without adequate vitamin D activity, calcium cannot effectively enter bone tissue. Some anticonvulsants accelerate the breakdown of vitamin D in the liver before it has a chance to perform its role. This means that even if a person consumes enough calcium in their diet, the body may struggle to use it effectively. Over time, this situation can contribute to reduced bone density and increased fracture risk. For patients who rely on these medications, monitoring vitamin D and calcium levels becomes an important part of long-term health care. The fifth medication on this list affects a very specific group of patients, but its impact on bone health is significant enough that it deserves careful attention. These medications are known as aromatase inhibitors. Two of the most commonly prescribed examples are anastrozole and letrozole. They are frequently used in the treatment of certain types of breast cancer, particularly cancers that grow in response to estrogen. These medications work by reducing the production of estrogen in the body. By lowering estrogen levels, they help slow or stop the growth of hormone-sensitive tumors. For many patients, this treatment is an essential part of their cancer therapy and plays an important role in improving long-term survival. However, estrogen is not only involved in reproductive health, it also plays an important role in maintaining bone density. One of the functions of estrogen is to regulate the activity of osteoclasts, the cells responsible for breaking down old bone tissue. Under normal circumstances, estrogen helps keep these cells under control so that bone breakdown does not occur too rapidly. When estrogen levels drop significantly, that control weakens. Osteoclasts can become more active, increasing the rate at which bone tissue is broken down. Over time, this accelerated bone breakdown can lead to a noticeable loss of bone density. Many treatment protocols involving aromatase inhibitors last for 5 years or even longer, which means the skeleton may be exposed to this effect for a prolonged period. For this reason, monitoring bone health during breast cancer treatment is extremely important. Bone density scans and regular medical follow-up can help identify early changes and allow doctors to take steps to protect the skeleton. Beyond medications themselves, the body sometimes provides subtle warning signs when important minerals are not being absorbed properly. One of the earliest signs may appear in the nails. Nails that become brittle thin or that peel easily can sometimes reflect deficiencies in minerals such as calcium or magnesium. Another common sign is nighttime muscle cramps, particularly in the calves. These sudden contractions often occur during sleep and can be associated with low magnesium levels. Some people may also experience persistent fatigue combined with pale skin. This combination can be linked to iron deficiency, another issue that may develop when nutrient absorption is affected. Finally, some individuals notice occasional heart palpitations or the sensation that the heart briefly skips a beat. Mineral imbalances involving magnesium and calcium can sometimes contribute to these sensations. None of these signs alone confirms a serious problem. However, when several of them appear together, especially in someone who has been using certain medications for long periods of time, they may signal that it is time to investigate further. After hearing about these medications, many people immediately begin to worry. They wonder whether they should stop taking the treatments that were prescribed to them, but that is not the right approach. The medications we discussed exist for an important reason. They control diseases, reduce symptoms, and in many cases save lives. The goal is not to abandon treatment. The goal is to become more aware of how these medications interact with the body and to take practical steps to protect long-term health. The first step is surprisingly simple, yet many people never do it. Take a moment to look at the medication you are using and read the name of the active ingredient, not just the brand name. Understanding the actual substance you are taking is the starting point for any informed conversation about your health. For example, a medication label may contain names such as omeprazole, prednisone, levothyroxine, phenytoin, or anastrozole. Recognizing these names helps you better understand how a medication works and what effects it may have beyond the condition it was prescribed to treat. The second step is to bring this information to your doctor during a regular appointment and ask a simple direct question. Does this medication have any impact on bone health? Many physicians focus primarily on the condition they are treating, such as stomach problems, thyroid disorders, inflammation, or neurological conditions. Bone health may not always be part of the conversation unless the patient brings it up. The third step is to request appropriate monitoring tests when medications are used for extended periods of time. One of the most useful tests is a bone density scan, which measures how strong or fragile the bones have become. In addition, blood tests that measure vitamin D, calcium, magnesium, iron, and ferritin levels can reveal whether the body is absorbing the nutrients necessary to support bone health. The fourth step is particularly important for individuals using corticosteroids. These medications should never be stopped suddenly without medical guidance. The body adapts to their presence, and stopping abruptly can trigger serious hormonal imbalances. When medications are managed carefully and monitored regularly, it is possible to treat underlying health conditions while still protecting the strength and resilience of the skeleton. There is a story that many physicians remember when the conversation turns to bone health and aging. A doctor once shared what happened to his own mother. Later in life, she suffered a hip fracture. At first, it seemed like an unfortunate accident, something that surgery and rehabilitation might eventually resolve. But recovery did not unfold the way the family expected. Because her mobility became limited, she began spending more time inside the house. Daily movement decreased. Activities that once kept her active and mentally engaged slowly disappeared. Over the following months, other changes appeared. Her memory began to decline. She became less oriented in familiar situations, and her mental clarity gradually faded. Now, it is important to say something clearly here. This story does not mean that every fracture leads to this kind of decline. Many people recover well and continue to live active lives after an injury. But the story illustrates something physicians see quite often. When mobility is lost, the effects can extend far beyond the bones. Movement supports circulation, muscle strength, balance, and even brain health. When movement disappears, the body and mind can both begin to struggle. As a physician, my personal view is very simple. Aging itself is not the enemy. Lack of awareness is. The medications we discuss today exist for good reasons. They control diseases, relieve symptoms, and in many cases they save lives. The purpose of this conversation is not to create fear or to encourage anyone to stop their treatment. The purpose is awareness. When patients understand how medications interact with their bodies, they can ask better questions, monitor their health more carefully, and work together with their doctors to protect long-term mobility and independence. Small steps such as monitoring bone density, checking vitamin levels, and reviewing medications regularly can make a meaningful difference over the years. Now, I would like to hear from you. Have you been taking any of these medications for more than 6 months without ever discussing bone health with your doctor? Or have you ever experienced a fracture that seemed to happen unexpectedly? Share your experience in the comments. Your story may help someone else recognize a problem earlier. And if you found this video helpful, consider sharing it with someone who might benefit from this information, and subscribe to the channel for more discussions about staying strong, active, and independent as the years go by.